Welcome back. The CDC says 1 in 5 kids in our country live with a mental health condition. And with back to school around the corner, one state making a big change to take care of their students. We're taking a closer look at mental health days in tonight's 360 Perspective.
The most amazing part about this whole thing is that it was student-led.
I'm personally in need of mental health days.
Those are 2 of the 4 students in Oregon who lobbied their state legislature for mental health days and succeeded. Derek Evans just graduated, but told lawmakers he struggled with anxiety throughout high school.
Being marked absent, unexcused, can't make up these assignments because I don't have the willpower to go to school today because it's just too much, and there was no system set in place to help me.
Oregon has one of the highest rates of teen suicide in the country. Here in Colorado, suicide is the leading cause of death for young people ages 10 to 24. And nationally, suicide is at a 50-year high. Now, under the new Oregon law, mental health days will be considered excused absences. Students will not be penalized and they can make up their exams. They'll be able to take up to 10 mental health days every 6 months, but school districts can also make their own decisions on that as well. Now, Utah passed a similar bill last year. Florida also now has a law that students take mental health classes starting in 6th grade to learn the signs, symptoms, treatments. Now, some worry mental health days may end up stigmatizing kids who use them, but one principal says it won't be any different than a sick day.
I don't believe Bethel School District would discriminate between a mental health concern and a physical ailment as a reason for a student absence. It doesn't matter. If the student needs care, the student needs care.
There has been some backlash on social media, some wondering if kids are going to take advantage of these days. I Skyped with Dr. Jason Williams of Children's Hospital Colorado. He's been working with kids in behavioral health the last 25 years. He says mental health should be taken as seriously as physical health.
It's equally as important. We know that there's a lot of literature and research now that describes when you have good physical health, you can also have good mental health and vice versa.
He says we'll have to wait and see whether kids use the days to actually care for their mental health or if others will just play hooky, but he believes the positives will far outweigh the negatives with this.
I have not read any studies specifically around mental health days and the use of mental health days. There's very good evidence to suggest that when one's mental health is really well taken care of, that academic studies, social relationships, the ability to participate in after school activities, everything from drama to music to sports is impacted in a positive way.
And here in Colorado, Senate Bill 195 was just signed into law. That will work to make mental health care a state priority, creating a task force to increase public understanding and awareness of youth behavioral health needs. Now, as far as adult mental health days, Dr. Williams says kids are usually the driving force for change, so he's excited to see where this may lead. What do you think about this topic? Sound off on our Facebook pages, KOAA 5, also Elizabeth Watts News. Go there right now. And if you have an idea for a future 360, email 360@koaa.com.